Hello everybody, I appreciate the opportunity to share our work to you today. And my talk, sorry, I have to share my screen first. Here. Can you see my screen?
Yes, it's visible. Just please put
Yes.
it.
Okay.
Yes, thank you.
My talk is about the efficacy of rosudamascena on liver enzymes in non-alcoholic fatty liver disease. First of all, I'd like to acknowledge all of my research team members, especially my PhD students, Dr. Ali Moravej, who made valuable contributions to this work. I'm Dr. Roshanak Quds, Associate Professor of Persian Medicine and academic member of Iran University of Medical Sciences, Tehran, Iran. As all we know, NAF or non-alcoholic fatty liver disease is a common cause of chronic hepatic disorders and has multiple involves multiple factors and has various complications, both intra and extrahepatic, and lifestyle modification and antioxidant and immunomodulator drugs are recommended for its treatment. Since treatments are limited, making new drugs or new approaches for treatment for finding new treatment options are crucial. RD or rosudamascena has hepatoprotective effects due to its phenolic and flavonoid components, which are antioxidant and anti-inflammatory, which have antioxidant and anti-inflammatory properties. In animal studies, its effect to reduce accumulation of TGs and inflammation in the liver was approved, but up to now, no clinical trial have evaluated its efficacy on the liver, fatty liver patients, so we designed this study to assess its effectiveness on the NAF patients. Here are some photos of the plants, and our trial design was a clinical trial, and its protocol was approved by Ethical Committee of UNS and was registered in IRCT. The study was done in Behesht Clinic affiliated with UNS in Tehran, and the study was done between March to November 2020. And the inclusion criteria was the patients who were aged 18 to 80 years old and have NAF disease, and their liver enzyme were raised, especially with ALT or ILT over than 50. And their ultrasound reports were shown grade 1 to 3 of fatty liver. All the disease or complications that may interfere with our outcomes were excluded. RD was collected in Marand city that is located in eastern Azerbaijan and authenticated by a botanist, and were assigned a washer number, and rose petals were carefully separated from the sepal and dried, crushed, and put into 500 milligram gelatin capsules. Placebo capsules contain 500 milligram of toasted flour. Capsules were coded, sealed in number envelopes, and packaged identically to conceal group assignment. Our intervention was performed on 74 NAF patients. They were block randomized to 1 gram powder or placebo 3 times a day for 12 weeks with lifestyle modifications. Patients and researchers were blinded to group assignment. LFT, blood glucose, lipid profile, and blood pressure were measured at the beginning and at the end of the study. Experienced radiologists performed liver ultrasound at baseline and study end. Here you see a study flow chart. We had one patient lost to follow-up in each group. Results showed that most of our patients or participants were male, and they were aged from 30 to 50 years old, and research and intervention group or RD group showed a significant decrease in serum ALT, waist circumference, and TG and cholesterol and LDL, and this group showed an elevation in HDL. And systolic and diastolic blood pressure were significantly decreased in intervention group. Also, fatty liver grade was significantly reduced in intervention group. No adverse effects were reported. Here you can see the details of our variables, and because of time constraint, I prefer to go through all these slides very quick. And results show that RD could reduce liver enzymes, especially ALT, and lipid profile and blood pressure. As I mentioned before, RD possesses anti-inflammatory and antioxidant properties, and this is because of its flavonoid compounds. And these compounds can modify cytokines, particularly interleukin-6, TNF-alpha, and interleukin-1b. And this property led to their proposal as effective drug for treatment of autoimmune disease. VEGF-C is a cytokine that plays a role in NAF, and flavonoid may target it in treating NAF. And the positive effect of RD on reducing the TG may be due to its its inhibitory effect on pancreatic lipids, and its anti-lipase properties may reduce TG. And on the other hand, its inhibitory effect on HMG-CoR enzyme may help us to reduce cholesterol and especially LDL-C in our patients. And flavonoid components inhibit de novo lipogenesis and modulate intestinal microbiota imbalance. And also this component has cyanidin 3-OB glucoside that help this product, this plant, to have anti-hypertensive properties by inhibiting ACE enzyme. And the last PowerPoint talk about the Persian medicine point of view about the Rosa Damascena properties. In Persian medicine, RD has multiple properties, has multiple faculties. It means it is murakkab al-quwa. It acts as exhilarant, mood elevator, and demulcent, and neutralize excessive heat that is accumulated in body by yellow bile. I mean musakkina safra. And also it can be astringent or laxative, completely depend on the climate or place that it will be cultivated. Rose water also is beneficial for tonifying all organs, especially main organs of the body, and is even useful for promoting healthy digestion. In Persian medicine, tonifying drugs protects organs by moderating their temperament and tissue consistency. This property causes it no longer accept unhealthy substances and develop properties such as dissolution and removal of obstruction, I mean mofatteh. And this property helps the organ cleanse itself and eliminate harm caused by unhealthy substances, that here is fats and their metabolites. Thank you so much for your attention. If there was any question, please contact me via email. Over to you, Dr. Ahansazan.
Thank you, Dr. Holtz, for your informative presentation.
Thank you so much.